Hello, everyone. Good afternoon and welcome from EIT Health. It's a pleasure to be part of this annual Biotech in Europe forum again. Usually we would have held it in Basel, and in the previous years it was always a great pleasure to be there, but this time although this conference had to be moved to online. So I would like to present you a bit what EIT Health did in the past months, supporting best-in-class European innovation and tackling the COVID-19 crisis. So if we start talking about EIT Health, I hope most of you know EIT Health, but for those that are new and that haven't heard any talk about or any introduction about EIT Health, please let me briefly summarize. EIT Health is Europe's largest healthcare initiative, most probably the largest initiative worldwide. And we have representations all over Europe. So as you can see, EIT Health is covering 6 regional innovation hubs, so-called co-location centers in Scandinavia, UK, Ireland, Belgium, Netherlands, Germany, with headquarters, with international headquarters in Munich, but also France, Spain, and InnoStars. That is our regions covering mainly Eastern Europe, but also Portugal and the Western European sites. EIT Health has expertise from all areas that matter to healthcare. We have 56 industry partners representing all kinds of insights, from pharma, medtech to digital, which is getting more and more important. But besides industry, EIT Health also covers and includes 44 of top European universities, a lot of healthcare providers connected in most cases to those universities, so university hospitals, all kind of research institutions, payers, incubators and clusters, and also cities and regions. We are very proud that 6 of the 10 top global pharma and medtech companies are part of EIT Health. But also if you look to the academia, all the top 5, according to the Reuters innovation ranking, and almost 50% of the top 25 are partners of EIT Health. And also the top X-raters, a lot of investors and large volume healthcare providers, as well as leading educators, are part of our network. If you have a quick look on the list of logos, you definitely will identify some of them. EIT Health X-rater is one of the 3 pieces of the 3 pillars that we have at EIT Health. So one is innovation, one is education, and the third one is business creation. In our X-rater, so the business creation piece, we support startups from very early stage in the ideation phase, going via incubation through scale up and scale out to finally successful companies. And along that way, we always help them with their validation. You have to start with validating your ideas when you have the first early stage ideas, but you also have to validate if a healthcare market would be the right one to enter with your product if you go global. So if you, for example, want to launch your product in China, Brazil, or the US, of course. Just a few key figures and numbers. Startups supported by EIT Health have attracted almost 250 million euro in the past years. They have brought 87 products and services on the market. We have supported more than 750 startups, and EIT Health was named one of the 2 most promising X-rater programs worldwide in the latest UBI ranking, global UBI ranking. That was a great success also for us, and of course, ambitions are high to stay in that league. Our access to finance instruments that we offer at EIT Health to our startups to launch successful financing rounds are manifold. We have our investor network, which is more or less a combination or a group of a platform, a local platform of investors in each region that ideally should also syndicate to invest cross-border into companies. So in the end, all kind of business angels and small VCs are grouped together in the investor network to access our deal flow at EIT Health. Our crowdfunding platform is the first platform that allows citizens from all over Europe to invest in any startup that is on the platform, also from anywhere in Europe. So first time a Spanish citizen can invest into a Scandinavian startup or vice versa. We have created the legal framework for that. And our latest achievement and the latest big step, our Venture Center of Excellence, where we team up with the European Investment Fund to make sure that corporate investors and other strategic investors can team up with our support with venture capitalists and other investors that are approved by EIF. And once these two, strategic and private investor, come together to invest in one of our startups, EIF is leveraging that investment. That's a big success that we finally got the commitment from the European Union and the European Commission to get the first budget into our envelope. And last but not least, also our EIT COVID-19 crisis response instrument, the Startup Rescue Instrument, where we were able to support many startups in Europe that struggled to just close their financing round due to COVID-19. We also have created a large network to fight COVID-19. So within EIT Health, we have launched a community response platform. We have established a lot of connections within our partnership of needs and offers that were brought together. Our alumni network also addressed many challenges through collaborative work. We have launched a lot of new projects through our rapid response program. And we also have dedicated quite a bunch of our 50,000 euro vouchers, our Head Start vouchers, towards solutions within COVID-19 space. And I spoke already about that. The Startup Rescue Instrument was one of the most important pieces from our EIT Health perspective to address COVID-19 issues. So if you look to that, that was our community response, and you can see that there is so many activities that have been launched by our partners, and we just want to promote those activities. The joint connections, it's almost a marketplace where we brought together requests and offers from our partners to join forces in that crisis, has been very successful. And we had, as you can see, we had 89 community responses posted on the website, 24 offers and asks that were published on the website, and many thousand views in the very first moments in March when the crisis went up. The Head Start program, I already mentioned that very briefly, was opened in March, on March 31st. So we also were very quick in launching that activity. And within a very short 2 weeks deadline, young startups could come up with their proposals, their ideas, how they would like to address or how they think they can address COVID-19 related issues. And that was very close to really bring help through due to the TRL 8 level. So they had to be ready to immediately launch the product on the market. And as you can see, we get many applications from all our regions, and the TRL level was really at a very high level. The startups that we have selected and that have received these 50,000 euro vouchers are shown here. So if you want to get in touch with some of them, just get in touch with us afterwards. The rescue instrument was focused on startups that were a bit younger, so TRL level 4 in biotech or TRL level 6 in medtech or digital health. They had to be incorporated after 2013 or in or after 2013. And we supported them with a 500,000 euro grant. But this grant was not for free, so we wanted to get options in return, and we wanted to see also a co-investor. So we wanted to see a private co-investor still believing in that company and providing an additional 50% co-investment, so at least 250,000 euro. You get 121 applications. Out of those 121 applications, in a very thorough, multi-level, multi-step process and approach, we have selected 11 companies that we have presented in the last online SACS forum. And it was a great pleasure to see them celebrating. And most of them, 9 out of these 11, have concluded all negotiations, and we have started the whole program together with them. So they are on our rescue track. Bridget is also something, a very important project that we run within EIT Health. Bridget is our program where we bring companies that are already successful in a European area, but not in the whole European market, into another European market. So let's imagine a Scandinavian startup.
French market can be supported through our Bridget program. The same is also true with Bridget Global, where we bring companies that are already successful in Europe to another global market like the US, China, Brazil, or others. These programs usually are so successful because we allow people to interact in person. So we bring them really physically together. Now, this is not possible during COVID-19. Therefore, we had to move that also to online. But as you can see, and I think that is very, very important, in a survey, we asked them if they really were satisfied with what we offered online, what we usually do face-to-face. And the outcome was surprising to us. So 11% said it was good, and 89% said the virtual matchmaking was even excellent. And no one said it was average or even poor. So we're very proud on that. Nevertheless, as soon as we can move back to face-to-face, we will do that. MedTech Live, also another German trade fair, was a good opportunity for us to do an online competition, startup pitch contest, as we called it. And we had several very good companies that won both either the MedTech or the Digital Health Prize. And we even had another winner for the Public Audience Awards. If you want to get in touch with them or hear more about them, please just let us know. We also brought a lot of startups to the virtual HIMSS conference that was focusing on digital health 2.0 this year. And this one is also a very nice one. Our Head Start program, I already briefly spoke about the Head Start focused on COVID-19, but we also have our normal Head Start that we run every year. But since this year, we have launched and initiated a collaboration with the United States National Academy of Medicine and their Healthy Longevity Grand Challenge. And this Grand Challenge has a very strong visibility across the globe, and we are more than happy that we had many applications. And these are the startups that received our €50,000 grant. This is startups from all over Europe that also have been fed into the Healthy Longevity Global Grant Challenge. This is the overview on the companies that you can meet during those days. These are the startups that take part in the annual Biotech in Europe forum organized by the SACS forum. So please, if you want to get in touch with those, you have seen some of them already on the slides before. These are very strong companies, very strong candidates that I would highly suggest you to interact and get in touch with them. Molevo, Naya, Patch AI, Indicate Solutions, Endobios, IQ Nano, Plisompo, Ancora, Mood, of course. Mood has won so many prizes within EIT Health. Evola, BiteLab, Genomics, Droplight, Bust Health for You, Keim, Nanoimaging, Wacker Health, and Crime. So a lot of great companies waiting for you. The next opportunity to see winners within EIT Health is the EIT Health Catapult. We have run the EIT Health Catapult since 2016. So far, we had 189 startups in the semifinals, Throughout 5 years, we have involved more than 250 investors that physically joined our semifinals, and a community including all the startups and mentors of 2,500 people. Of course, this time this will not be possible physically. So we had an online pre-selection in our regional offices and also with regional competitors and participants, and now also the semifinals. You see the blue dots in the middle will take place online. So you have the first time the opportunity to join all the semifinals online, and even the finals, the European Health Catapult finals connected to our annual summit will happen online. The semifinalists are here. Also, many names that you should look into. Since this is a biotech forum, you might want to look to the bottom right, but also the digital health companies are partially very well connected to biotech topics. The virtual pitch days, so usually a semifinal takes 3 days. That's also the case this year, but on the last day, after a lot of investor training and pitch training, they deliver their live pitch through an online forum, through an online medium. And on 21st of October through 23rd of October, you can watch the biotech, the medtech, and the digital health semifinals. Please register for that. You have access from everywhere and every time. You can watch it later, but I think it would be best to just join in person. And this is what we offer to you. So please come back to us if you're interested in joining our European Health Catapult semifinals and finals. The finals usually, as I said, took place in combination with our annual summit. This year, also our EIT Health Summit will be held online. That means you can also join the EIT Health Summit that usually was attracted more than 1,000 people. You can join that online. Big thank you to the whole team from Sachs Associates. Thank you so much for again organizing a huge online forum, and I'm really looking forward to interacting with as many as possible of you guys looking out to get in touch, and have a great forum, have a great conference, and talk to you soon. Thank you so much.